Dr. DeWeese is the best. He's one of those people who you immediately feel a connection with. You immediately get the sense that he's the type of physician that you would want your loved one to see, or that you would want to see yourself in the event you needed his services. I've observed the passion and the caring that he exudes and that he uses when he cares for our patients and his patients. And it's truly a special thing. He's warm, he's inviting. That's only complemented by his wife Pam, because when you see them together, it's truly, you leave feeling better about yourself, you leave feeling better about life.
Well, Pam and I both went to Speedway High School. We are high school sweethearts. That's about right.
Yeah.
So that's 50 years.
That was 50 years ago.
But we've been married for 43 years.
43 years while he was still in medical school. We got married the day after I finished grad school. We have two daughters, Adrienne and Stephanie. We moved to Avon in 1985 when I was pregnant with Stephanie.
I was approached by a physician who worked at Hendricks, and he asked if I would be interested in relocating my practice. And so that's exactly what I did. I moved my practice from IU to Hendricks. I was the first pulmonary and critical care doctor at that time.
One of the benefits of Eric's work schedule was that it provided me time for community service. And so I was a PTO president, I was a scout leader, and in 2006 I had the opportunity to start a not-for-profit organization for our schools, the Avon Education Foundation, and I served as its first executive director and president. I also served for 24.5 years on the Avon School Board.
As almost a solo practitioner, required to be on call, required to work any number of weekends. My involvement with the community has really been primarily through my professional medical services at the hospital.
Among the several things I wish that people knew about my husband was that his priorities have always been clear: his family and his patients. He loves being a doctor. He's the most intelligent, hardworking person I know. For example, it's not uncommon for doctors to be board certified in a couple of areas of medicine. But Eric took it upon himself to become board certified in 4 different areas. Not because anybody asked him to, but because he thought it was in the best interests of his patients and HRH.
He's definitely inspired, a work ethic in both of us. Watching him pour hours into studying for the boards and watching him, he works as hard as a person can and still has time for his family.
And gets up in the middle of the night and goes into takes the time, in the middle of dinner, he has to go in the car and have a conversation with somebody who needs something.
Yeah, he's like the first person I ever knew that had a cell phone. He's the last person I know that has a pager. Like, he just, he's always available to his patients and to his colleagues, but he's always been available to us too.
Eric is calm, pragmatic, and humble.
Dad is just one that he doesn't seek out the attention for it. He does it because it's a passion for him. It's something that he really cares about.
When I met Eric 50 years ago, I asked him, "Why do you want to be a doctor?" And his answer was clear and revealing. He said, "I can think of no more noble profession than to care for the sick."
To think of the number of people that he's treated in his career and those ripple effects, that's...
Yeah, all the patients and their families. He definitely has made an impact, probably more than anybody knows.
He has subtly, as is his way, helped raise the bar for the treatment of pulmonary, critical care, and sleep disorders at HRH for the future. And he's not done yet.
I want to personally thank Dr. Eric DeWeese and his wife Pam and his family for the contribution that they've made to Hendricks Regional Health.